We have a philosophical question we have to answer, which is, have we actually made society better? If people are living longer in poor health, is that what we set out to do? And it's not what I set out to do. I don't think it's the mission of the clinic. We want to improve happier, healthier days on the planet.
Welcome to Unlocking Big Data, a series about getting trusted data to healthcare decision makers presented by HIMSS. In December 2023, HIMSS Market Insights conducted research with 100 healthcare leaders to understand perspectives on the use of data analytics platforms. Throughout the series, we'll present key data points from the research and focus on why these data points are important and how you can leverage them to support your healthcare organization's data initiatives. Today, I'm joined by Albert Marinez, Chief Analytics Officer at Cleveland Clinic, and Michael Meucci, President and CEO of Arcadia. Welcome, Albert and Michael.
Thanks for having us.
It's great to be here.
The research tells us that 56% of healthcare respondents cited that quality of care was the most important goal that data empowers for their organizations. This was followed by increased workforce productivity and then identifying cost savings. Those were the top three. Yet despite the numerous advantages that the data provides these organizations, they also cited significant barriers. And that had to do with competition with other strategic priorities, the complexity of integrating and onboarding, the lack of internal resources, and budget constraints. And there's also a difference between kind of what leaders at larger institutions said versus smaller. At multi-hospital work sites, they were significantly likely to face more resistance from the workforce and the staff, whereas smaller organizations cited insufficient IT infrastructure as a barrier. So Albert, I'd love to start with you. You faced resistance and barriers at the different institutions that you've helmed. Can you tell me about your strategy in terms of overcoming some of those?
All of those barriers that you listed, they are real. And many times, when we look at these tools and solutions to implement an analytics platform, they are expensive. They cost a lot of money, plain and simple. And yet we are in the healthcare business of taking care of our patients that are coming through the door. So how do we reconcile some of that? You mentioned some of the challenges are around the strategic priorities and the competing priorities that causes. I think first and foremost, analytics should be there to support and embolden those priorities and the strategy of the organization. It shouldn't be in competition. So the first thing that I like to do is to consider what are the strategic priorities of the organization and ensure that our analytics tools and solutions are directly aligned to that work. When we do that, we now have a specific case that directly aligns, and then we can drive value from there.
You've talked a little bit about use cases where you can really demonstrate the value of these platforms and how that can in some ways overcome some of these barriers. And I'd love you to share some of that with us.
Yeah, I mean, there are numerous use cases. I think of one around patient access. People want to come to Cleveland Clinic. That's one of the great things about the clinic is that they offer world-class care. And so it's really important to us that we have the best opportunity for patients to come through our doors. But we have challenges when it comes to scheduling and when it comes to how we best leverage the slot availability across our providers. So one of the use cases that we've done is to actually use machine learning to predict and forecast what are the available slots that we have across our organization every week, every month, and then doing that by specialty across our institutes in the organization. What that allows us to do is to then optimize for where we have gaps, plan much more effectively when we have vacation and time off, sometimes that we may not originally immediately see on the calendar, but that we can more proactively anticipate. That allows more patients to be seen if we are effective in that way.
And there's also efficiencies to be gained on the provider side and the use of, other parts of the enterprise. So if you'd like to share a little bit about some of the work looking at the utilization of the OR, et cetera?
Yeah, well, it's a great example, Indu, because OR use and time in the OR is one of those things as well, and it is really challenging. We have intuitive models that tell us we know pretty clearly how long a patient is going to be in an OR room, and a lot of that is based on intuition. But we're able to use forecasting models to tell us much more accurately how long a patient is going to be in the room. We can use things like what medications are they on, the demographics of that individual, the physiology. All of these elements can come together for a more accurate forecast. And here's what's crazy. If we have a 1% more efficient scheduling across our patient population, that translates into thousands of patients that we'd be able to see in our organization. So even a small improvement can yield big gains.
Yeah, that's quantifying that is really remarkable. So Michael, you've been doing this work for many years, but we're at a juncture, a change, if you will, in how AI and analytics are intersecting. I would love to hear your perspective as a platform partner on how you think strategic plans need to shift in light of this inflection point.
We're at this really interesting pivot point in technology across all industries, not just healthcare. When Albert and I first met 4 or 5 years ago, we were talking about how do you implement a data platform that enables self-service analytics, mostly to enable a team of data scientists and analysts and report builders to better serve their customers who are business users, whether it's a leader of care management looking to understand the productivity of his or her care management team, or a managed care executive going into a payer renegotiation, wanting to understand performance to a contract. But the way the questions were asked was you'd have an executive going to the analytics team, submitting a ticket that got groomed into a backlog, and then a report was built or a request was fulfilled. But we now live in this world where LLMs and generative AI allow business users to have conversations with robots that can get you much closer to the answer much faster. And it has a multiplying effect on the value of platform, like a high-performing platform can deliver to an organization. And it also has a huge job satisfaction effect for the technologists, the data scientists, the report writers, the business intelligence engineers on their job satisfaction. Because instead of writing the same report on how many diabetics are coming through our doors or how many OR slots do we have available in the next 30 days, they can focus their time and effort, and organizations can point those teams at much bigger questions. One of my favorite statistics that I've heard over the last couple of years is, as a Western civilization, we've done a great job at expanding lifespan. People live longer. That's an overall win for healthcare. But if you dig beneath the surface, you'll find that 50 years ago, 100 years ago, the same proportion of people lived in poor or moderate health that live in poor or moderate health today. So we have a philosophical question we have to answer, which is, have we actually made society better? If people are living longer in poor health, is that what we set out to do? And it's not what I set out to do. I don't think it's the mission of the clinic. We want to improve happier, healthier days on the planet. And then you can point your analytics teams at those big questions. Maybe that's expanding access into communities that otherwise don't have access to care. Instead of just trying to figure out where the next OR slot is, fixing the access problem fundamentally from the ground. And so as we look at the ability for generative AI and large language models to connect business users with an answer and still recreate the experience of working with their favorite analyst, because that happens. You have those executives who say, oh, I need Jake to work on this analysis for me. All of a sudden, everyone has access to Jake, and Jake is self-learning and has access to this massive knowledge graph across your organization. So I think it's a really wonderful time because across industries, we're really democratizing access to information. And it's the new self-service, not the self-service the way we thought about it 5 years ago, which was effectively just deploying Power BI or Tableau across your enterprise.
I think this is fascinating. And Albert, I can see kind of both sides of the coin here in terms of democratizing AI, because you also have an enterprise to run in an aligned manner. So I'd love you to talk about some of the workforce implications Michael just spoke about in terms of what this is going to mean for upskilling a workforce literacy, But also, in this world of democratized AI, how do we keep things aligned at the enterprise level? An organization as large as the clinic is going to need some guardrails for that.
Yeah, without question. And just to tee off of what Michael was sharing, this is truly game-changing. I've heard it said the hottest new programming language is English.
Yeah.
And how we do and engage with the work and with the data absolutely changes fundamentally the work and the way we do work. And it shifts the focus on the quality of our platforms and the quality of our data in order to serve up the most effective data and analytics possible. But you're asking a question around how do we scale this and how do we consider the innovations that some of that can enable at the enterprise. And when I think about this, I think about them in twofold. One, we've got to enable the agility and the innovation that happens in a number of these smaller areas to experiment at scale. And that can't be a top-down approach. That has to be a localized, enabled, and empowered system and organization. And that has to be part of our strategy. At the same time, the guardrails need to be in place with consistent platforms, with consistent rules of engagement around how we ensure that the data is of high quality when we engage with it. At the enterprise level, we've got to identify those big rocks that are going to move the needle on creating the synergies and the performance that we need that demonstrate value, that also fund those smaller experiments and our overall strategy, both at the analytics level and at the organization's level.
Right. So multiple perspectives, a lot of both exciting challenges and opportunities ahead. Thank you both for being with me today and for this conversation.
Thanks so much.
Yeah, it's good to be here.
Be sure to catch the companion HIMSSCast podcast with Albert and Michael for more on the business case for investing in a data analytics platform. For HIMSS TV, I'm Indu Subaiya.